50% of physicians, roughly, depending on what study you're looking at, are burned out right now. So if you're a patient, there's a 1 in 2 chance the person you're sitting across from is not at their best. I think the amazing thing that I found is there are a bunch of us out there who are so ready to make change. And I think the key is going to be aligning those individuals, bringing those voices together for change. And when we do that, when we solve that, then we're going to see some noise happen.
I'm curious to hear about some of the organizations and companies that you're working with now that you have come out of really the clinical or medical side of it and are advocating for those changes.
For sure. And there's several layers to this, even, if you will. So the nonprofit that I do the most work with is Medicine Forward. And the mission statement for Medicine Forward is catalyzing positive change so patient-physician relationships can flourish. So we're not looking to take over all the programming or do all the programming. We're looking to highlight others that are doing amazing things and add an accelerant to their work. And so as a patient, if you're looking for a way to contribute, skip your morning cup of coffee at Starbucks, or no offense to Starbucks, or you get the idea. Skip your morning cup of coffee.
I don't like Starbucks.
All right, there you go. Donate to a nonprofit that's trying to move the needle.
Thanks for tuning in to the Healthy Careers Podcast. In 2024, we reached over 32,000 listeners and ranked in the top 15% of all podcasts. We're proud to have SharePro Health as a sponsor and are currently looking for 2 more partners in 2025. If you're looking to connect with healthcare leaders, providers, and innovators, we'd love to spread the word about your service, product, or business. Reach out to me, Maddie, for more details.
The group that I work for, and I do a little bit of part-time clinical work, is emergency care specialists. And they're doing some amazing things to move the needle in terms of care delivery outside of the walls of the ER. And so they've developed a clinic called the Right Care Clinic, which fills the void between traditional urgent care and the ER. So imagine a near ER level of service with an emergency physician, emergency room nurse, CT scan, IV fluids, IV medications, radiology, but you don't have that facility fee attached to it. So much more cost-effective, higher acuity care. It's absolutely brilliant, and it really embodies the quadruple aim, which I suppose I'm hitting many of these little topics.
Yeah, that was a good segment.
Not intentionally, but and the quadruple aim is quality care, lower cost, patient experience, but also provider wellness. And when you use that as a lens, when you're making decisions, the majority of stakeholders win. But when you're just using that, what's the ROI? The detrimental effects to that could be massive. And then finally, I'll throw it out there. The documentary title that we're working on is Suck It Up, Buttercup, Trust and Betrayal in American Medicine. And so if you're interested in learning more about that, it's suckitupbuttercupfilm.com.
Yeah, let's talk about that a little bit. So what inspired you to start that, and who is it in collaboration with? Like all the things, I'm curious to hear about it.
So I will say that the inspiration wasn't from me. It was actually from a good friend of mine, Marianne Wilbur. She's a GYN oncologist that stepped away a couple of years ago, honestly related to just a whole host of systemic issues that were frankly crushing her as a human being, and she had to make a decision. Am I a doctor, or am I a mom and a parent, and et cetera? And she chose this one, and I give her tons of kudos for that. But her dream was to turn her book, The Doctor Is No Longer In, into a documentary. Serendipity had it that she lived by a wonderful documentarian, John Modern. Conversations occurred. Marianne and I talk all the time. She's like, Todd, I want you involved, but we also need to raise some funds. And I've got an entrepreneurial spirit. And next thing you know, it sort of became this organic grassroots movement. And as we got further along into it, and we had the teaser, and we started having a minimal viable product, it became very clear that it wasn't if this was going to happen, it was when this was going to happen. And when we got to that point, the amount of people who wanted to help or contribute or be interviewed or financially, I struggled to keep up with my phone at times just because it was so amazing. But I think it speaks to 2 things. One, the level of issue we have in this country that we really are looking to highlight with this project and show the American public what's going on. But 2, the number of amazing human beings who want to do something. And they need some direction, they need some hope, they need some connectivity. And I think the documentary is going to help with that, or at least I hope it does.
Yeah, it sounds like. And so when you were going out, because I saw the sneak peek, and I'll make sure that this is linked below too if you're listening, so you can check it out, because you will have to wait until August, September to see it, and we'll all be at the edge of our seats, because once you see this preview, I mean, you can tell it's going to be not only emotionally heavy, but really shed light on what's happening. And I think not only should physicians watch it and people that are in healthcare, but I think patients need to watch it, because they don't see, and now that I'm in healthcare, I'm a lot more cognizant of it when I walk into the doctor's office and I can tell something's off, right? Like they either just had a patient that it was their worst day ever, and they're having to, within the span of 30 seconds, go from that room to my room, right? And have a happy face on and pretend like that horrible thing didn't just happen. Because if they didn't see, this amount of patients within the hour, well, then they were going to get kind of the slap on the hand, if you will. But, how did you determine who you were interviewing or talking to for that documentary?
Oh, yeah. So, well, and we're still in that process now. And so a couple points here. One, when you first start on a project, right, you tend to go to your close friends and family, et cetera. And as a physician, of course, a lot of my friends are physicians, right? And so the initial teaser was physician heavy, if you will. And that totally makes sense, right? You get two physicians kind of starting the project, so we're going to go to people we know and love. But the reality is, as we go forward, we're going to have ideally voices of CEOs, administrators, nurses, patients, family members, et cetera. We want this to be a variety of stakeholders. And then the second part to that is you're creating a documentary. And again, remember, I'm a physician, I'm not a filmmaker, but the story gets built as you go. You get a little nugget here, and that leads you down this rabbit hole or this connection. And so as John would say, hey, we need somebody to talk about this, Marianne and I would go out to our network and say, hey, I'd like to talk to you or talk to this person. Or a recent example, a physician who has sued a hedge fund that, wrongfully terminated him, from what I understand. And this article is in the LA Times, and I'm not going to get into the specifics. But you got these people out there that, in my mind, they're heroes. They're standing up to the garbage that is going on in the sake of the almighty dollar. That's not what I went to school for. So, yeah, it's this sort of organic, natural process. I joke that we're building the plane as we're taking off, and to some degree we are.
That's my favorite way of doing things. It drives some people nuts